Today is National Diabetes Alert Day, and what an alert we have for you if you're not familiar with the numbers. According to the CDC, more than 1 out of 9 Americans are diabetic, and of that group, 1 out of every 5 diabetics don't even know they're diabetic. And that's not even mentioning pre-diabetes. We'll get to that. Want to talk to a doctor about this. Good morning. Coming in from Southington on Zoom, Dr. Lori de la Portilla. Thank you so much for joining us today. How are you?
Thank you for having me.
Yeah, glad to have you here, but to talk about what is very much a growing problem. And I want to start by talking about people who might have diabetes right now and maybe not know it. It's that 1 in 5 group that I want to start with. What are some signs we should all be looking out for in ourselves that could be a clue that we're either diabetic or pre-diabetic?
Absolutely. So it's so important to be aware of the signs and symptoms of diabetes. Classic signs can include increased thirst, increased urination, specifically at night. Sometimes we see increased appetite, sometimes blurry vision, and occasionally unintentional weight loss. However, it's so important to know that 1 in 5 patients have no symptoms at all. So that's the importance of seeing your provider to have screening done.
What does that screening usually consist of when you go to your healthcare provider?
Absolutely. They'll sit down with you and talk about your risk factors, family history, if you've had a history of diabetes and pregnancy, if you're overweight or obese. And then they can do a simple blood test that could be done sometimes in office or at the lab. And they'll check your blood glucose level or something called a hemoglobin A1C, which gives us your average blood sugar over the past 3 months. From there, we'll be able to easily diagnose and start a treatment plan in those who are indicated.
Let's talk about pre-diabetes, too. I didn't even get into those numbers. The CDC says 96 million adults in the U.S., 38% of the U.S. population is pre-diabetic. What does it mean to be pre-diabetic?
Yes, to be pre-diabetic means your blood sugars are elevated, however, not to the degree that we see in diabetes. So they're at increased risk of all the complications that can come down the road with diabetes, but it's at a great point to be diagnosed because we can still do a lot through lifestyle intervention, weight loss, and in some cases, medications. But we do watch our pre-diabetic patients closely and monitor them more regularly for diabetes.
And let's talk quickly in the short time we have left about those lifestyle modifications. How much of it is just controlling your weight and controlling your sugar intake?
That plays a big part of it. Optimizing a healthy weight and having regular exercise is important. They did do a large study on patients with prediabetes and found that if they lost 7% of their body weight, about 60% of them, they decreased their risk significantly. So it does play a big role. It's not all of it, but it's important to know. And if we catch it early, we can really start those lifestyle interventions.
One last real quick question. Almost all of these cases of diabetes are type 2 diabetes. How many of those cases are reversible through proper intervention?
A lot of diabetes is treatable. I never like to say fully reversible. We can go into remission and treat that, but we always want to be on the watch for if it recurs. But a lot of diabetes you can conquer and we can treat and do very well.
I like that, remission instead of reversible. Words matter, and thank you so much for drawing that distinction. And thank you so much for the knowledge, Dr. de la Portilla. We do appreciate it, certainly.
Thank you so much.